anything that we can do to make people's lives better, to help them be more functional, to help them be able to do the things they want to do.
Right.
Really, that's kind of at the forefront, I think, of both of the work that we're doing. And so I think that's why this is really, for us, such an exciting partnership.
Yeah, me too. Yeah. Hello, welcome to another episode of What Rubbish, Holistic Treatment to Breast Cancer. And today we're excited to have a special guest, Dr. Jennifer Ligibel. And we have known each other for almost a year and a half, I guess. And since our conversations, we have now partnered. And I think Jennifer will talk more about some of the things that we are doing, but I'm excited to have her here. But I think today's purpose is going to be more diving deep into the integrative oncology and the holistic side that the integrative oncology group brings into the treatment for breast cancer for women.
Great. Thank you. Thank you so much for having me here. So I'm a medical oncologist at the Dana-Farber Cancer Institute in Boston. I work with women with breast cancer. And I am the director of the Leonard P. Zakim Center for Integrative Therapy and Healthy Living here at Dana-Farber.
Yes, okay.
So really for me, my work in this area started, it's hard to believe, but almost 20 years ago.
Gosh, okay.
And it really started in response to a question that my patients asked me really pretty much every time I was in clinic, which was, Dr. Ligibel, what can I do to help myself? And at that point in the early 2000s, we knew a lot about chemotherapy and radiation and anti-estrogen treatments for women with breast cancer.
Right.
But there really wasn't much of an answer to that question other than, try to take your tamoxifen.
Right.
I was really interested in trying to figure out what people could do to help themselves feel better and live longer. And so started studying exercise. Really have always been very interested in exercise on a personal level. There were data coming out at the time that showed that people who had kind of an unhealthy metabolism, so higher levels of fasting insulin and glucose,
Right.
had poor outcomes in early stage breast cancer. So people that could potentially have disease that could be cured had a higher risk of their disease coming back if they had this unfavorable metabolic profile. So I was really interested in starting to study how could we affect metabolism with things other than medications. And that really kind of launched my interest in that area.
Interesting. Okay. Sounds really fascinating. And how does now you're the head of the Zakim Center. I'm finding it a little bit difficult.
You're not from Boston.
I know. the Zakim Center.
Yes.
So how does Zakim Center now makes their vision in terms of the hybrid approach that you guys are taking? I use the hybrid approach because it's a combination of holistic and the medical treatment that goes for the cancer patient. Can you explain a little bit about that?
Sure. And I think what you're getting at really is kind of the core of integrative therapies.
Right.
And, for a long time, people thought about complementary therapies or alternative therapies. And it's a little bit different than the concept of integrative therapy, which means that you are really thinking about all of the different treatment modalities that could be helpful to a patient who's facing a cancer diagnosis. So integrative therapy thinks about the interplay between our standard Western therapies, things like the chemotherapy and the radiation, but also exercise, diet, things like acupuncture, mindfulness, really thinking about all of the dimensions of an individual that are impacted by a cancer diagnosis. And so integrative therapies really thinks about using an evidence-based approach to think about all of the different ways of treating a patient that could be beneficial to them.
Okay, thanks for clarifying. Yeah.
Sure. No, and I think that's one of the things sometimes people say, well, what's the difference between a complementary treatment and an integrative treatment? And I think some of it is that a lot of the treatment modalities are the same, but it's sort of the vision of what are we trying to do? And we're really trying to integrate the care of the patient to make sure that we're addressing all the needs that they have.
Yeah, go ahead.
So I was going to just say, the Zakim Center has actually been a part of Dana-Farber for the last 20 years. And it was really founded with the mission of bringing integrative therapies to patients to help alleviate the burden of cancer and to studying the most effective ways of integrating these therapies into people's lives. So we really have this kind of joint mission of both patient care and research, which is really kind of the foundation of Dana-Farber more broadly.
Okay. Now, one of the things that we experienced when Alka was going through the treatment, we were unaware of the integrative oncology piece that was within the institution that she was getting treated at. Now, how is your center making known to patients out there that they can take advantage of your Zakim Center over here?
And I think what you bring up is a really, really common challenge that many of us who focus on improving quality of life and mitigating symptoms experience when working with patients with cancer. Because many times when people are diagnosed, and especially as cancer treatment has become so complicated, very high tech, that it can be difficult to kind of understand all of the different aspects of treatment. Many of my patients, because I work as a medical oncologist.
Sure.
I prescribe chemotherapy, endocrine treatments. Many times when people are first diagnosed, they really kind of have a little bit of tunnel vision. It's an overwhelming diagnosis, and they're thinking about, what does this mean for my life? What does this mean for my family? How many treatments do I have to get through? What does my schedule look like? And in that setting, it can be really hard to break through that for something that isn't mandatory. Your surgery is mandatory. The chemotherapy, all these things are kind of, you don't feel like you have a lot of choice. And sometimes it's really hard. We talk about this all the time, not just here at Dana-Farber, but really across many institutions that provide these services. Like, we can build it, but will they come?
Right.
And so we do have kind of a multi-pronged approach to trying to bring people in. Now, one thing that we have done within the last about year and a half is we hired an integrative oncologist, a doctor named Ting Bao, who works with a physician's assistant to really start an integrative medicine service. And this is a medical service, really, where people come in for a consultation. We kind of go through the treatment they're getting, the symptoms they're experiencing, and really build a platform of what kind of integrative services would be helpful to you as part of your cancer regimen.
Is there some kind of a questionnaire that they...
Yes. So there's a questionnaire. We actually have them talk to a pharmacist to think about supplements, because a lot of people have a lot of questions about, do supplements interact with cancer treatment? Is there value of different things? So that is a really effective intake process. So when people come to the Zakim Center in that way, we are really able to get a very holistic view of all of their needs, all of the other therapies. So that's one way. And so, we have seen about 500 people in the first year of that new service being in existence, which is really exciting.
That is. Yeah.
So other ways that people find us. So we do a lot of advertising, and sometimes we have people that are really excited. You're going to meet some members of our team. They're really excited in an exercise program, or really, really have nutrition questions, or they're looking for mindfulness, or they saw an ad about journaling in our creative arts program. So we have a lot of people who have a specific interest, and they kind of seek this out. We advertise all over the institute. And so that's kind of another way that people find us.
To that, I have a couple of questions and thoughts and comments. I'm going based on the experience that we had. When the patient walks in, a woman with breast cancer walks in, obviously the first point of contact, either it's a surgeon or it's a medical oncologist. Either one, depending upon how they come across. Now, is there a way that at the forefront, the conversation about the integrative oncology doesn't come in? Is there something that Zakim Center is looking into it as to how to include that as a part of a team?
So I will say that we have kind of looked at different ways of bringing this therapy to people's understanding. And, this is also akin to, we've done a lot of exercise research over the years where we have tried to bring people into the program at different points in time. And I think the hardest study we've ever done, and you're going to meet Nancy Campbell, who is an exercise physiologist who works with us, and she will attest, one of the hardest studies that we've ever tried to enroll people to was one where we were trying to enroll them when they first came in to Dana-Farber, because people are so overwhelmed at that point of time.
Mentally, psychologically, yeah, exactly.
So we used to put brochures in there's this welcome packet. We never once had anybody that pursued our services that way. So we found that it works better to have people kind of get to the point where they have a little bit more feeling of they know the path in front of them, they're a little bit more settled in, and that is a place where it's often more fruitful for us to try to engage people then. The other way that we really bring people to the work that we're doing is through research studies. Actually, a couple of my team that you'll meet later have taken part in a big study that we did for people who had finished their treatment for breast cancer.
Yes. You mentioned that.
Christina Conti you'll meet, along with Nancy, were coaches in this big study. And that study enrolled women who had actually finished all of their chemotherapy and things. And we found that was a time when a lot of people were looking for, what do I do now? And really looking to make behavior change. And, Mike Carrier, who you'll meet also, is now leading a new program that we're doing that's bringing people in at all different parts of their journey, because I think there's not a one-size-fits-all.
No, it is not. Yeah, I agree with that.
You might feel like at that very first meeting would be the best time. I think that it's just...
Actually, my point was more of making the patient aware of what's out there within the center, rather than coming at a point might be too late. That is where I was getting at. So
we hope is that it's never too late. But
exactly. So I think what I'm excited about is also the fact that I'm learning more and more about this piece of the puzzle that was unknown to us. And I think the more I study into it, read into it, the more I learn about it, it's making me more even excited about the fact that what I sense from you is that Dana-Farber is very proactively looking at these things much more in depth. They are involved in the research programs. And I think talking about the research, tell us about the research that we have collaborated with. Maybe you can give us some perspective as to why did you partner with Alka Ohri Foundation and the purpose of the research that you are heading right now.
Absolutely. So, and I think in terms of the partnership, I think we both really share the desire to find a way to help people live the best lives that they can. Cancer diagnosis is a really difficult thing. And living with advanced disease is also
scary.
Really scary. And anything that we can do to make people's lives better, to help them be more functional, to help them be able to do the things they want to do, really that's kind of at the forefront, I think, of both of the work that we're doing. And so I think that's why this is really, for us, such an exciting partnership.
Yeah, me too. Thank you.
So our program that we are developing and kind of working together is a longitudinal healthy living program. We have been doing research now for 20 years in looking at how exercise and support around nutrition and weight management and all of those things really help people feel better, do better after a cancer diagnosis. Through the Zakim Center, we provide a lot of programming to not only to our patients, because through the pandemic, we developed a really robust web portal. We found that we were able to really help people more than just the people that lived within a 5 to 10 to 20 mile radius of Dana-Farber by developing a web portal where we have a lot of exercise and nutrition classes. But what we were finding was that it was hard for us to determine the impact this was having on people's lives and their function. And it was also hard for people to figure out, well, where do I start? What's the right program for me?
That's a big thing, yeah, exactly.
And so the program that we are working together and that we are evaluating through collection of information over time is a longitudinal program where we help triage people at the beginning. Like, where do you need to start this program? And then we have them work with Nancy one-on-one as a kind of in training.
Right.
Sometimes Mike will find that they need to meet with a physical therapist or an occupational therapist, or there's somebody that doesn't have a lot of physical challenges and really what they need is motivation. And then Christina works with them to help set a kind of goals, give them that encouragement, because this is a thing with behavior
Well, this is something
change.
that, you mentioned, you bring up a very good point. This is one of the things that I was, after the fact, unfortunately, I got really more concerned about lack of resources and providing one-on-one conversation or coaching to these women who are psychologically, mentally, physically are drained, and what we want to do is help improve their quality of life. So how are you bringing that into fusion? Because we are doing the research now. After that research, we want to see we want to see that on a daily basis, when these women are walking in, because they need assistance and they may not be able to do it by themselves because the insurance doesn't cover it. So how are you guys managing that whole issues per se?
So this is one of the things that we've studied for years is how do you help people make changes in their behavior that could be helpful for them, but that are so hard to do. I mean, for all of us, sticking to an exercise regimen, it's January 28th or 29th, somewhere in there.
29th, right,
so I would bet that many of us made healthy living New Year's
goals.
resolutions. And by this point in the month, a lot of people have kind of forgotten.
So exactly. Yeah.
It's not easy in the best of circumstances, but then you're facing treatment and the side effects of treatment and all the other things in your life that you're trying to make time for. So, this is one of the things that our group has studied is really what kind of support do you need to give people to help them meet those goals?
Right.
What kind of discussions, what kind of, what's the behavior change that we need to support people to do. And so, this is kind of the accountability of working with a coach that knows you, that knows what your goal is, that can help you figure out you didn't get there this week. What was it that got in your way? Let's try to figure out how to overcome.
So is there a proactive, not proactive, but is your folks, people who are involved in exercise, nutrition, like Nancy and Michael and Christina, are they reaching out to the patients? Or are the patients supposed to reach out to them? How is that working out?
So what we are testing is a structured program where people have appointments, where they're either kind of working, doing an exercise session if they kind of can't really engage in our, we have a lot of group-based sessions that people can take part in, but if they need additional supervision and support, they're working one-on-one. Or if they're able to kind of take part in group-based programs, they have a coach who is, they have a session. We're trying to figure out right now how often those should be. We can talk a little bit about that because people are busy, but they have a session with a coach checking in, how are you doing in meeting your goals? And this is very similar.
And you're also giving them homework to do at home.
Giving them homework to do, exactly. But I think that accountability is so important.
Very important.
Knowing somebody cares and is going to check and make sure that you're doing it and help you do it if you're not.
That is more important because that was missing. Unfortunately. And I could understand why it was missing because the Cancer Institution couldn't provide enough resources to do that. So, and I think we're trying to see how we can overcome that. The end result of this research project, what would you like to see the outcome as for these advanced group of women?
Our overall goal, kind of long-term goal, is to make healthy living be a standard part of the cancer treatment that we prescribe for all of our patients. And one of our major goals of this program is to really show how you can integrate this into cancer care in a way that's scalable. What are the pieces that we need? What are the people that we're serving? What are their needs? And what's the benefit that we see from this? What are the concrete benefits? Because as you try to get, and you and I have talked about this before, but one of the big barriers is who pays for this? And so, one of the things that we're really interested in showing are like, what are the kind of functional and practical benefits with a goal toward having this type of service be something that's supported by insurance companies.
Yeah, we want to talk to them after the data comes out,
right,
and hopefully,
exactly.
See if these insurance companies can see value, and I'm sure they'll see the value of that. Well, I think we come to the end of our conversation. So what message do you want to give to the women who have breast cancer, and what are the things that they should be watching or be careful for? What advice can you give them? That's very important also.
I go back to that question about what can I do to help myself?
Right.
And I feel like we have a lot more evidence now than we ever have before that there are things that people can do for themselves. Be active, exercise as much as you can. Think about your health. Like, we didn't talk a lot today about diet, but diet's important.
Very important. Yeah.
But the thing that I would leave people with more than ever is, yes, there are things that you can do to feel better, and we really hope to live longer. I think that's another piece of our research, but I think it's much more hopeful message than I had back 20 years ago.
Of course. Well, certainly there's a lot more options today. I think a lot more knowledge base and places where women can go and seek information. But thank you so much, Jennifer, for joining me this episode. And thank you, audience, for watching us and listening to us. We appreciate it. And have a look at www.alkaohri.org and get more insight, more information that is being posted on that on our website. And we appreciate your support. Thank you.